Hello, this will be the initial phase of start of my journey into writing a critical essay in health economics module, and the topic I have chosen is government intervention in healthcare markets and its effect on health behavior. So this is the guideline I have got it printed so that it is convincing and easy to refer whenever I need. So for now, what I will do is, based on the guidelines, I will search from Google, and then I also need to do literature review on the concept of health economics and the theories that are related to health economics, health behavior. So in that I have to find gaps in the literature review. So let's go.
So here there are many definitions that is provided by the Google Scholar. So I will pick. Let me sort it by custom range, that is from 2015 to 2023. Okay, let's go again.
Oh, I forgot to mention that today I will be just searching for the sources based on the criteria, and tomorrow onwards I will read the articles and find the informations that are relevant and need to understand those informations, gather those information and write in my own words through my own understanding. I got one definition about health economics, that is by the Johns Hopkins Bloomberg School of Public Health. So here it's reliable source because it is academic source, education, education. So it states that health economics is something that promotes healthy lifestyle and positive health outcomes through the study of healthcare providers, hospitals, clinics, managed care and public health promotion activities. So MHS in Global Health Economics degree program EAC in the department of
So today is the second day and I'm going to go through those articles that I've searched yesterday, and if it is relevant I will keep, and if it's not relevant while I'm reading through that I will just find for another article. For now, I am here to search for the introductory and overall study about the healthcare system of Canada, and I've found one content related to this. So yes, this is the details given by the government of Canada on its healthcare system. So I think this is a reliable source. So there is detail about the role of government, health expenditures, and also I will go through these references in detail. Hello everyone. today, and we are here to search for the source from library. Basically, we are just going to search book that is related to health economics, as we have to do literature review. So we will be doing So I think she's searching over there. Wait. Kahit ano siguro yun? Men, natin science ki yun. Science ki yun. Pa. Okay. Ano yun today? Economics today. Ano yun economics today?
I will extract this idea from here and put it in my essay. So we're done with the first book. Now going to the second book. We're just extracting the definitions. This is about health economics and financing. There's big price here. Big picture of the pig here. I think here it says, what is economics? Yeah. Supply. We are first going through the conditions. They do have, this book also have other theories that we have learned about physicians. We also have about, so let's just go to here. It's also okay. Now the first book talks about the choices in resource allocation in the medical services and Medicare, whatsoever in health. And this book connects with the economic concept, where there is transaction, demand and supply. So here the demand for health services and health is by the patients. They are the consumer, and supplier or a producer are the surgeons or the people who are working in the medical who are providing medical services to the people. So they are the providers. So here it says that, it also says that there's choice. Since economics is about theory of choices between various alternatives,
So here health economics is about the choice people make regarding their health, and choice that a consumer or the patients make regarding their health, and the choice that producers make regarding their regarding how to care for the people and how to earn money. And that is the again they mention that the third thing, the choice made by a government, a congress or community group. So here there will be opportunity cost. So the opportunity cost must be the cost of earning A by giving up B. So having this opportunity cost, that means when you earn A, it must not be less worth than what you have given up B. So this definition described like this, as well as the price that is the price that both the patients and surgeons or the physicians agree to. So that is actually the demand and supply curve, that equilibrium price. And moreover, one thing they mention is, so it relates to economics, why economics is brought into health. Without a development, without an economic growth, without an economic development, we cannot have a very productive and highly specialized, we cannot produce a highly specialized labor, that is the doctor or a physician or a surgeon that can treat the patients. So without economic growth, these benefits of having a highly specialized doctor will not be present. So that's why surgeons are regarded as the seller and patients are the buyers. There is transactions that is taking place between the buyers and the sellers. So this book is trying to define from my understanding, it is defining like this. So we have got one definition from here. Now finally coming to this book, Principles of Economics for Developing Countries by William Jack. We will refer one definition from here, and we will have four sources, including the health economics textbook that we are currently referring. So we will have four definition by four authors, four different sources. I think there is no specific definition mentioned in this, but it talks about from the perspective of developing countries, about the allocation of resources and the social concerns on inequity of health, inequity that exists in distribution of health services. I think the introduction does not specify the definition, but it talks about inequity that most developing countries are facing, even in terms of health economics. Not only means just health, but it also has major economic concerns such as inequity and externalities as well. So this much only. We've got 3 references, and later on we will find from some few sources of articles how the different authors to find them. Articles, or you can have other pages of World Bank, UNDP, and World Health Organization will have donations from them. Once again, I have written the literature review and the concept, but I think it is exceeding the word limit. It is coming right now 300 something. The literature itself is coming 300 something. So I've included so much of theories such as health belief theory, social cognitive, then planned behavior. I've included more too much. I don't know from which sentences I will deduct the words. I will have difficulty in exceeding the word, but still then I will keep it for now. And now I'll move on to the analysis of health behavior and I guess I will club that with healthcare demand and supply, because demand and supply is also related to the health behavior. So I'll club it because I'll have limited words for now. So right now I will show you my AC. Yes, this is the current status of the AC. So here I'm following the rubric, but I guess I have exceeded the words too much, so I'll keep this up to here. And now moving on to my main topic, that is again I'll be writing about the Canadian health system. Let's go. Let's go with the Canada's healthcare system. Access to healthcare based on need rather than ability to pay was the founding principle of the Canadian healthcare system. Medicare was born in one province in 1947. Its speed spread across the country through federal cost sharing and eventually was harmonized through standards in a federal law, the Canada Health Act of 1984. The healthcare system is less true national system than a decentralized collection of provincial and territorial insurance plans covering a narrow basket of services which are free at the point of care. Administration and service delivery are highly decentralized, although coverage is portable across the country. In the setting of geographical and population diversity, long waits for elective care demand the capacity and commitment to scale up effective and sustainable models of care delivery across the country. Profound health inequities experienced by indigenous populations and some vulnerable groups also requires coordinated profound health inequities experienced by indigenous populations and vulnerable group also require coordinated action on the social determinants of health if these inequities are to be effectively addressed. Achievement of the high aspirations of Medicare's founders requires a renewal of the tripartite social contract between governments, healthcare providers, and the public. Expansion of the publicly funded basket of services and coordinated effort to reduce variation in outcomes will hinge on a more engaged role for the federal government and the physician community than have existed in previous decades. Public engagement in system stewardship will also be crucial to achieve a high quality system grounded in both evidence and Canadian values of equity and solidarity. So this is the summary of the passage I'm going to read about. Yes, it gives ideas about what is the medical system of Canada, that it is mostly Canadian healthcare system is people have free access They don't have to pay, rather their payment is based on their need. And their Medicare was born in 1947, and the cost sharing among the federal is eventually harmonized by the standard federal law. So the Canada Health Act of 1984 is a very important thing. I'm going to write introduction from here. The healthcare system is less crude national than this bit introductory I can give from here. So let's go. Hello, welcome back to my channel. So right now I have moved towards searching relevant sources and searching for the government interventions that is carried out in Canada's health system. So I will identify mainly the three government interventions and the policies or the programs. So based on that, I will see its effect on the healthcare. So okay, let's go. Basically, under the government intervention, what I'm supposed to do is find recent policies accordingly with the guideline. I should find the recent policies that is not outdated but the recent ones, and how this has affected the people's behavior, health behavior. So let's go. Now to search for the health policy, firstly I will just directly search from Google. Latest health policies implemented by government of Canada. It was a bit I was over analyzing the topic that I ended up understanding at the initial phase. I ended up understanding that I should just see the intervention of government like in a very perfect competitive market. When government intervenes, it creates like market distortion. I was thinking kind of like that, but I'm supposed to find only the impact of policies and programs that has on health outcome, that has effect on the health outcome and the utilization of healthcare. So I'm just supposed to search for these things only, not the pre-concept or the pre-understanding of the topic. So when I search for the policies, so it states that they have undertaken many under the Public Health Canada's healthcare website. It provides many policies such as for the programs of health promotion and chronic disease prevention. They have Aboriginal Head Start in Urban and Northern Communities program, then Canada Prenatal Nutrition Program, then Community Action Program for Children, Innovation Strategy Nutrition North Canada, preventing gender-based violence. So health promotion, then chronic disease prevention, awareness for health promotion and chronic disease and injury prevention. So these are the programs. So and these are the list of programs. Now I'm going to search for they do have the health policy of being a universal health insurance being providing universal health insurance coverage, but the problem here is this has been there from since the enactment of Canadian Health Law Act in 1984. The Canada Health Act in 1984. So I may not get data before prior to this plan. Now I'm finally done with my essay, and now I'm going to sleep. And right now I have not done proofreading, so I will do proofreading tomorrow. Then after proofreading, then I'll submit the essay. So the final essay of mine is I've not written the conclusion. This is the final essay. I guess I've exceeded the word. This is the references. Though it is right now 1200, I guess it has included the references. So here I have the literature review, then the theories. Here I have not written the analysis related to health behavior because I couldn't get much data, as they say that Grossman model is not applicable for Canadian health is mostly regulated by government intervention. So I will have to take consideration of other theories that we have studied, such as the theories under health disparities, because I think they are all relevant related to income, then inequity or disparities exist in Canadian health system. Then I have also, now my main thing is the government intervention, which I have taken one in the program, that is universal health coverage of government. It is government intervention in health market, and this impact is on overall. I've talked from the overall perspective, where I've also shared the strength and the weaknesses of this program according to the survey of 2017-18, then yes, and 16. And one thing is I've studied about single pay system. That means where the government is the sole buyer, not a buyer, but the sole body that pays for everybody's health services. But this is according to Tu Hai. He critically analyzed that this is the system where it was initially started by the elite groups, and if we look at it critically, it is actually a system of monopoly where people pay taxes and the whole thing that is run by government. It also will lead to monopoly, and this can relate to the thing that the weaknesses I've mentioned is inequity. Equity, they have also indigenous Canadian and non-indigenous. So indigenous Canadian, they usually face the problem of inequity in medical facilities services. So this single pay system has not addressed this inequity issue. That is the major drawback. So weaknesses of the from the small weaknesses of the Canadian universal health coverage, one can draw lessons that while having adopting a universal health coverage that Bhutan also have right now. So I think that Bhutan also need to take consideration of whether the current free health system is applying well or not, and whether there is a need to adopt other system or better policies so that it will ensure equity in a more very sustained way, because we are already we have already trade off that with efficiency. So if we are to ensure equity, we must have a very proper system that removes reciprocism, then monopoly system, and all those things to ensure that this program government intervention is very effective in promoting a good health behavior among the people. So to promote a very good health behavior among the people, what I feel is there needs to be this health system need to be very good one and effective one. So unlike the case of where being a free public good will always create a problem of free ridership, then such as having to wait for medical services. So this is the very drawbacks of universal health coverage. So somehow being in the medium, not too much into private health system, or too much into public health system, being in a very medium one, I think that will be the best solution. So for now we are done with the AC writing, and tomorrow we will be proofreading.
Good morning. So today I'm going to proofread my AC that I've wrote yesterday. So basically, I will quickly read through my AC.
Now I've done proofreading, so I'll give my friend to proofread. Yeah.
Martin highlights the citation look depending on same point. Click on the
Hi. Medicare inches. Now I'm finally done with my essay. I even gave my friend from proofreading, as well as I also did proofreading. So everything's done for now, and now I'm going to submit this. The time is 9:07 and I only have 1 hour time or 52 minutes to submit. So I'll submit right now. Now my document is queued for the plagiarism checker. So let's wait how much plagiarism it is coming. Now after a few minutes wait, I can see that my plagiarism has come 32%. So let's see from where it has come from. These are some of the sources that I have cited. So there's not much issue here. So we're done for today. Now this will be my final vlog. My vlog didn't take for a longer time because I only studied this assignment recently as I was engaged more in the other assignments. So for this final vlog, I would like to, based on the guidelines that I've missed in the earlier vlogs, I would like to tell about few things. That is already the research literature review. I have highlighted a few about collecting books from library, and regarding the theories, I've thoroughly googled that and searched for the related theories of health behavior. And regarding the data collection, I did not do any primary data collection. And when I read through the Canadian health system, I found the article by Martin et al. States that the Canadian health market provides universal health coverage that is very different from USA, which is privatized. However, he mentions that there is existence of inequity among the people, usually the indigenous and the non-indigenous Canadians. So this I related to the social disparity theory we have studied in our syllabus, that disparity also affects the health decision of the people. Though I have not been able to strongly support it, I did put some of the references and data to support that from the sources that dates to 2017. And regarding the challenges I have encountered during the research process is, firstly, I started my writing lately. That was my biggest challenge, to complete on time, and as well as at the same time, but it was also difficult in finding the resources. Usually not that it is not that resources not provided. There are resources, but the problem is I couldn't give appropriate words. I have challenge in giving the keywords to the Google Scholar to search. So that was a challenge I faced, and at the same time I also encountered challenges such as not being able to complete one article within a given time. That is, understanding the article and its standard was a bit difficult for me. So these are the few challenges, and the major challenge with me is only my attitude. That is, I studied this research lately, and the innovative thing I would like to say is, I have used I've used ChatGPT to comment on whether my introduction is well written or not, and based on the comments I have improved on those things. So I improved my writing based on the comments that is given by ChatGPT, but I didn't directly copy it from it, just I took into feedback from it. So but I could not do for all the essays as I ran out of time, so I have done mostly for the introduction. So this I could regard is an innovative solution, as well as I've included weakness and solution, weakness and strength for my essay, which last time in my last essay that I've written on environmental economics, I was commented, I got a feedback that I've messed up all the informations, so I tried to differentiate it with strength and weaknesses separately. So this is the innovative thing that I think I have brought it. And the knowledge, I have learned plenty of lessons regarding a small thing about health Canadian health system in Canada and its history, bit of history, and what its disadvantage and advantages, as well as I've also studied or known about the existence of inequity despite providing universal health coverage. So this can also relate to Bhutanese context, where we are also provided free health system that is much relevant or resembles Canadian healthcare market. And these are the lessons that through the research it has taught me. And I have learned a lesson that it is always good to start a work very earlier, because you will have more time to do more research, and your research, once research becomes more scopeful and handy. But in my case, I started off late, and this has may have impacted my essay. Then coming to the ideas, it emerged means these are the ideas where I have used subtopics based on the rubrics, and this weakness and strength I've tried to implement the SWOT analysis that is taught in GSC class last semester. So this is the whole thing about my research. So this brings me to the end of my assignment and the vlog. Bye bye.